Hey guys, Tim here with PTProgress, and today we're looking at tennis elbow, how I approach tennis elbow in the clinic, and the exercises I give my patients to resolve tennis elbow. Let's take a look at those. Okay, so the first thing that we do in the clinic is I look at someone's posture, because if you're feeling pain here along the forearm and you're saying, hey, look, I've tried everything, I've tried massaging this thing, this is not going away, we've got to look beyond the arm, and I always look up at the neck and the shoulders. And so if you have a chronic posture of like a head forward, where your shoulders are rounded, maybe you're typing a lot, that can really affect the entire chain of muscles down the arm. And so we're gonna address that first. And so I tell people right away, right out the gate, we've gotta get those shoulders back like you're putting your shoulder blades in your back pockets. Now, if you can do that 100% of the way, I want you to think about just doing that 50% of the way. I don't want you to strain your shoulders trying to squeeze back. I just want you to get those shoulder blades engaged and then back down. You can do that maybe 20 times. And so this is just the very baseline of exercises that I give people right out the gate just to work on their posture, squeeze the shoulder blades a little bit, and relax. Notice with that exercise, I'm not hunching my shoulders up like this. I'm simply bringing the shoulder blades down and back, and my upper trapezius, that muscle right here, is not being engaged. Sometimes that's a culprit with people who are suffering from tennis elbow. It seems like it's really far off from an anatomy standpoint, but it really makes sense when we think about how if we shrug our shoulders can rotate inward, and it can change the mechanism of how we reach and pick up things. So I want to keep the shoulders back and the neck relaxed. If it's very tight in the shoulder, I might add a stretch for the trapezius. And so that's just bringing the neck forward, maybe slightly down, neck to the side, slightly down, holding it for about 15 to 20 seconds. So those are some of the exercises that I give right away. If they've got poor posture and they're suffering from tennis elbow, I'm gonna have them engage those shoulder blade muscles and also stretch the neck to start. Okay, the second thing I want to address about tennis elbow is, yes, you can put ice on there, and I encourage that, to put ice on that affected area, maybe even cover it with a cloth for sure so you don't burn your skin from the ice. But you can take an ice cube or an ice pack directly over that, and you can put ice massage for 3 to 5 minutes, just gently massaging that area. It'll become cold, it'll be like a burning sensation, it'll become achy and then numb. That's the typical pattern of ice massage, and that can be good for decreasing inflammation locally. You can do that a few times a day, but that in itself is not going to get rid of tennis elbow. So it's just not. I want to focus on one stretch for tennis elbow, and that's having that arm outright. And so we're going to extend that arm straight down. You can bring your hand into a fist, stretch and hold that for about 10 seconds, making sure that this elbow is locked out. I'm not going to drop down the shoulder, I'm not going to bend the elbow, we're not going to get a stretch that way. Arm's going to go out straight, and the wrist is going to go down forward. I can do that on this side, hand goes down. I feel more of a stretch when I bend my fingers towards my body. So we're gonna hold that stretch for about 15 to 20 seconds and do that multiple times a day. Now, the second variation of this stretch, once you've got that mastered for a day or two, arm down, holding that there, is to bring the hand so that the pinky goes towards the ceiling. Okay, if you can notice that, the pinky is going towards the ceiling, and it's even better if you can do that passively. And so the other hand will do the motion for the affected arm. So if I have tennis elbow right here, it's irritated, I'm gonna bend that down, use my opposite hand, and turn it. I'm gonna try to keep the rest of the arm straight, but we're gonna hold that position for about 15 to 20 seconds. You can even hold it down, so my arm is down here. I could do that same stretch, holding it outwards. It doesn't have to be right in front of you, but just for a visual, that's where we're going with that stretch. I want you to try that for a week or two. Hold that for about 20, maybe even upwards of 30 seconds, and see if that can relieve over time. The first indicator that you're on track for improvement is to decrease pain when you first wake up in the morning. If you have tennis elbow, you'll notice that right in the morning, that thing is really sore and painful. But as you do these stretches, extending the arm and rotating that hand outward there, one of the first things that I hear from patients is that they start to feel that difference immediately in the morning. When they wake up, it's not as sore. And so we're gonna start with that exercise. We've got the neck going, we got the strengthening of the scapular muscles with your posture, and we've got this twisting stretch of the arm. So I tell people to work on that for a week or two, and then we're gonna go into the second part, which is strengthening of the arm with eccentric exercises. All right, so if you have tennis elbow, the last thing that I want you to do is to grab a weight and just to start working your arm, your forearm muscles. They're already irritated, we don't need to do that, but what we can do is work on strengthening in an eccentric approach. So it's less irritating to the tendon if we do an eccentric exercise, and by that I mean this. So we're gonna rest our arm on a level surface like your knee or the table. And so from here, what I'm gonna do is I'm just gonna start with my hand just relaxed. And I'm gonna take my opposite hand, I'm gonna help it up and hold it in that position. And then we're gonna lower it back down. And so I'm gonna use my opposite hand and hold it and then just lower it back down, just the weight of my hand. Here's the thing, if you just sit here with your arm at the table and you go up and down with your hand and it's painful, then you're not ready to progress. It's really difficult just to relax that muscle right here. And so the key is to use that left hand to raise it. Now you hold and slowly lower. That's the eccentric movement. If I were to actively work that muscle, that's a concentric movement, but I want to lower it from the extended position. So I'm gonna help it with the other hand, hold it, and then to lower it down. Of course, we get into further strengthening once that becomes less irritated, once that becomes easy to do without engaging that muscle on top as we extend, then I wanna add some weight to it. So I'm gonna add maybe a pound or two. And again, I'm not gonna just crank that with the arm, I'm gonna help it with the other hand. I'm gonna extend it up, hold it for a second, and then slowly lower it back down. See, from a slightly different angle, I could help it up, hold it, and it slowly lowers back down. So work that into your routine, 2 to 3 sets of 10. It's not about getting exactly 10 repetitions in, it's about getting that repetition without irritating that forearm. If you start to feel pain, you just back down from that. Maybe you go back to a stretching routine and then progress into that strengthening afterwards. And people ask me all the time, well, when should I stop stretching? Well, I think it's a good thing to continue stretching. You don't just stop and then wait until you get tennis elbow again. I think that's a good routine to get into to make sure that you maintain some flexibility in that forearm so we don't re-irritate that area with activities in the future. So maintain those stretches. You don't have to do it as aggressively or as often, but you can maintain that as a regular part of your routine and your overall health. So don't just give up on those cold turkey as you're feeling better in the forearm. Mix those into your daily routine. Now, if those exercises feel really dinky and oversimplified, I mean, they are really simple exercises. I'm encouraging you just to give those a try. That's what I tell my patients. Give it a shot, give it a try. It's not gonna feel like you're lifting heavy weights, but if you want some resistance, you might get one of these TheraBands and throw it around something like a door handle, or if you have a pole like this, is great. I think this is a good progression when you're working on scapular strengthening. So the shoulder blades, you're just bringing those arms together. And so it's a nice way to reinforce that good posture. But we have to really be concerned about what's happening with the wrist. So if you notice here, I'm gonna try to keep my wrist as neutral as possible and then pull it in this way. I'm not gonna allow my wrist to extend back. I'm not sure if you can see that exactly, but I want it to be neutral. I don't want the wrist to extend out. And you might be having that as an issue if you're exercising and you're finding that you're having tennis elbow when you're lifting weights or you're doing overhead presses or whatever it is as an activity. That's why activity modification is so key when it comes to tennis elbow, because we inadvertently do this extension motion of our forearm, which just causes further irritation of that tendon along the top of the forearm. So activity modification to avoid that type of extension motion is really key, whether you're working out, grabbing a bag off of the ground, lifting up your kids, or putting away dishes, whatever it is. It doesn't matter what activity is causing the irritation, but just noticing that you are getting an irritation in that arm and seeing how is my hand in neutral, is it not in neutral? And making that change can be really effective to decrease irritation and minimize pain as it's healing. So activity modification is important, so I hope that you're mindful of that, but give those stretches your full attention for the next couple of weeks, and I think that you'll feel some real results from that. Another thing that I've used in the clinic before is this, the stick. It's literally called the stick, and you can find it on Amazon. And so I'm just gonna brace it on my knee, and I'll just roll my arm along that. And so it's a good way to get like a soft tissue massage to the arm. But again, we're not focusing on the area that is painful. We're trying to identify ways that we can think outside the box. Maybe your shoulder blades are too far forward. Maybe your posture is horrible. So we're gonna think about all those components, and then we're gonna add some stretches, and we're gonna do some soft tissue work to the area. Whether you get a tool like this or not, it doesn't really matter. What matters is that we make a conscious effort to improve our posture as best as we can. We think about activity modifications to avoid irritating that forearm when we're reaching or lifting things, and we get more consistent with performing stretches like this outward hand stretch with a little bit of a turn out to the side. Those things are going to be the biggest bang for the buck when it comes to getting rid of tennis elbow, and hopefully you see some results. If you have some other stretches or techniques that you've found to be really helpful, go ahead and put those in the comments. Everyone's a little bit different, and so I encourage people to share those types of ideas or strategies, because there's not one cookie cutter way of getting rid of tennis elbow, because everyone has different tasks or activities that they're doing. But stretching can really help, and activity modification, of course, along with your posture. Take a look at your posture. If you have questions for me, let me know. If you found this video to be helpful, go ahead and hit that subscribe button. We'll see more videos like this in the future. Thanks for watching, and we'll see you in the next video.